Hello everybody. Welcome to my channel. Today the topic I have for you is herpes simplex virus, also known as HSV. Today we'll be looking into HSV1 and HSV2. Let's look at the structure. Virus. It has a unique four-layered structure, a core containing the large double-stranded DNA genome which is enclosed by an icosapentahedral capsid, composed of capsomers. The capsid is surrounded by an amorphous protein coat called the tegument. The tegument is encased in a glycoprotein-bearing lipid bilayer envelope. Let's start with herpes simplex virus 1. HSV1 typically is characterized by a cluster of small blisters or watery vesicles on the skin or on mucous membranes. Clusters most frequently occur on the lips and face and occasionally on the trunk and hands. HSV1 may also infect the eye, causing corneal ulcers and visual impairment. The occurrence of a lesion heralded by tingling and burning in the skin area, which becomes red and covered with vesicles. These vesicles break and form a crust, and the skin appears normal within 6 to 10 days after the onset of the lesion, unless there has been secondary infection. Healing normally takes place within 14 days. Following the primary infection, the virus migrates to the neuron as a latent phase. During this phase, HSV1 produces a non-coding strand of RNA, ribonucleic acid, that is cleaved into very short segments called microRNAs. These microRNAs inhibit the cellular production of proteins that have the ability to reactivate the virus. Viral reactivation, which causes lesions to be precipitated by any one of a number of factors, such as sunburn, upper respiratory and gastrointestinal tract infections, fevers, emotional stress, or anxiety. The sexually transmitted disease genital herpes is associated primarily with HSV2. The virus is highly contagious and may be transmitted by individuals who are lifelong carriers but also who remain asymptomatic. Infections are most often acquired through direct genital contact. Sexual practices involving oral genital contact may be responsible for some crossover infections of HSV1 to the genital area or of HSV2 to the mouth and lips, while other crossover infections may be the result of self-infection through hand-genital-mouth contact. The incubation period for HSV2 infection is usually 4 to 5 days but may be as short as 24 hours or as long as 2 weeks. The first symptoms may be pain or itching at the site of infection, followed within a day or two by the appearance of blister-like lesions that may occur singly or in groups. In females especially, generalized symptoms such as feet malaise may develop, and lymph nodes in the groin may enlarge. Urination may cause great discomfort. Lesions may persist in this stage for a week or more, and complete healing may take 4 to 6 weeks. Genital herpes is generally more severe in females and may become so uncomfortable and disabling as to require hospitalization. These are not uncommon and may be associated with emotional stress, trauma, sexual intercourse, other infections, or menstruation. Symptoms may not be as severe in recurrent infections as in the initial one. In males, symptoms of genital herpes often start out very mild. It's easy to mistake them for signs of a small pimple or ingrown hair. Herpes sores appear as small, red bumps or white blisters. They can pop up in any area of your genitals. If one of these blisters ruptures, you might notice a painful ulcer forming in its place. It may ooze fluid or cause you pain when urinating. As the ulcer heals, it'll form a scab. Other potential symptoms include itching and pain in your genitals, flu-like symptoms, including body aches and fever, and swollen lymph nodes in your groin area. Infants born to mothers with active genital herpes may acquire serious infections, including infection of the central nervous system. HSV2 can cause death in 60% of infants and severe intellectual disability in 20% of surviving infants. The virus may be transmitted to the infant as it passes through the infected birth canal. If active genital herpes is diagnosed in a pregnant woman near term, cesarean is usually recommended. Herpes simplex 1 and 2 are frequently benign but can also cause severe disease. In each case, the initial lesion looks the same. A clear vesicle containing infectious virus with a base of red, erythematous, lesion at the base of the vesicle. This is often referred to as a dewdrop on a rose petal. From this pus containing pustular, encrusted lesions and ulcers may develop. Herpetic gingivostomatitis can be the result of an HSV1 or an HSV2 infection. In primary herpetic gingivostomatitis, the typical clear lesions first develop followed by ulcers that have a white appearance. The infection, often initially on the lips, spreads to all parts of the mouth and pharynx. Reactivation from the trigeminal result in what are known as cold sores. The disease is more severe in immunosuppressed people such as AIDS patients. Herpes keratitis. Herpes keratitis is an infection of the eye and is primarily by HSV1. It can be recurrent and may lead to blindness. Herpes whitlow occurs in people who come in manual contact with herpes-infected body secretions and can be caused by either type of herpes simplex virus. The virus enters the body via small wounds on the hands or wrists. It can also be caused by transfer of HSV2 from genitals to the hands. Herpes gladiatorum is an HSV1 infection caused by direct skin-to-skin contact, mostly seen in wrestlers and rugby players. Eczema herpeticum, which is found in children with active eczema, pre-existing atopic dermatitis, and can spread over the skin at the site of eczema lesions, can also spread to other organs such as the liver and adrenals. Herpes simplex virus also causes proctitis, which is an inflammation of the rectum and the anus. HSV encephalitis is usually the result of HSV1 infection and is the most common sporadic viral encephalitis. HSV encephalitis is a febrile disease and may result in damage to one of the temporal lobes. As a result, there is blood in the spinal fluid and the patient experiences neurological symptoms such as HSV meningitis is the result of an HSV2 infection. The symptoms of meningitis caused by HSV seem to resolve spontaneously. Doctors usually can diagnose genital herpes based on a physical examination and the results of certain lab tests like viral culture. The culture involves taking a tissue sample or scraping off the sores for examination in the laboratory. Polymerase chain reaction (PCR) test can also be done. PCR is used to copy your DNA from a sample of your blood, tissue from a sore or spinal fluid. The DNA can then be tested to establish the presence of HSV and determine which type of HSV you have. Blood test can also be done to analyze a sample of your blood for the presence of HSV antibodies to detect a past herpes infection. There's no cure for genital herpes. Treatment with prescription antiviral medications such as helps heal sooner during an initial outbreak. It lessens the severity and duration of symptoms in recurrent outbreaks. It also reduces the frequency of recurrence and minimizes the chance of transmitting the herpes virus to others. So, that was it for today. Let's have a look at some questions. A 27-year-old man presents to the A&E with a 2-day history of severe headache and pyrexia. 38.9 T scan shows petechial hemorrhage in the temporal and inferior frontal lobes. What is the most likely diagnosis? A. Brain abscess. B. Meningococcal meningitis. C. Cerebral malaria. D. Or herpes simplex encephalitis. The answer is D. Herpes simplex encephalitis. Herpes simplex encephalitis is recognized worldwide as the frequent infectious encephalitis. In children older than 3 months and in adults, HSE is usually caused by herpes simplex virus type 1 and is localized to the temporal and frontal lobes. In neonates, HSE is usually caused by herpes simplex virus type 2 acquired at the time of delivery, and brain involvement is generalized. So guys, that's it for today. Thanks for listening. Make sure to like and subscribe.